Hi, this is Ronika Wahi. Today I have with me Carola Schmidt from Brazil. Thank you, Carola, for joining me. Um,
Hello.
these days, we have on the internet a lot of information that's available to us on every topic under the sun. But whether that information is authentic and reliable um, is something very tricky to actually figure out. Because there's just too much, and everybody can put in information on the internet, right? So particularly when we talk about medical issues, and if we have some problem and we start searching things on the internet, at times we might be none the wiser after reading articles, but certainly more jittery, right? Because they tell us a number of possibilities, and when we don't have the right resource person to know what is actually the correct thing, it becomes even more terrifying for us, right? So that is why it's important that we have information from the right sources. So today I'm going to speak to Carola Schmidt about one of the most dreaded diseases, which is cancer. She is a pediatric oncology pharmacist and is a writer on books on cancer. She's written scientific books as well as books for children, sorry, on cancer. And her expertise has been developed through extensive work that she's been doing over the years. She has extensive experience in chemotherapy and stem cell transplantation, and she's worked with various hospitals, clinics, and pharmacies. Her work, her research work, and her guidelines are being used by healthcare professionals worldwide. And her books, particularly her books on children, are very important resource, because we can understand that cancer is something which is very difficult for adults to deal with, and for children it becomes even more challenging. So her books play a very significant role because they show very positive, happy illustrations and have encouraging words. And the best thing about her books is that she does not at all suggest that cancer is something easy to deal with. But at the same time, those books give positive vibes, ensuring that the kids who read them feel more positive and more encouraged to deal with the situation that they are in. So, and there's a lot more that she's done. Of course, you can check out the details about her profile and her books, her scientific books, as well as her children's books on her website. The link will be there in the description box of this video. And without wasting any more time, I'll just directly go to the expert and ask her questions. So, I'd like to thank you again, Carola, for taking out the time for this. Um, and okay, so the first thing that I want to ask you is, one of your scientific books is on chemotherapy and pharmacology for um, pregnant women. So you're trying to talk about the best guidelines and best practices, the strategies that women need to keep in mind. So what are some of the essential things that you would say that pregnant and lactating women need to keep in mind, if they are suffering from leukemia?
Leukemia is a very aggressive disease, so there is no easy way. And when there is no easy way, we need to count on people around us to be willing to receive support, to welcome the help and trust people. We healthcare professionals are ready for that and to receive the way. So my best advice is to trust people, to trust your healthcare professional team and count on them on all levels: psychological, medical, human. Most hospitals have a complete team to treat these patients, with pharmacists who are specialists in hematology but also experienced in neonatology. There are clinical pharmacists and a whole group of physicians with hematologists, obstetricians, neonatologists, and nurses of several areas, psychologists, social workers. Trust them and find out the resources available at your hospital. In many hospitals, there even are lawyers available who can advise patients. There are organizations as well, and books like those on kidscancerbooks.com are wonderful to help patients.
Okay, thank you for sharing that. And just okay, so see, we know that cancer is affecting a lot of children. So, are there ways in which this can be prevented in children, or how can we ensure that children do not get cancer?
For kids to develop well, healthy food is a priority. So I tell parents and caretakers should be cautious with food and make restriction when necessary, but find good resources of science to help you in this decision. These new diets that are in the media all the time can be harmful, especially for kids who are not sick and don't need restrictions. Read the labels, find out what you're eating, be careful with fast food, celebrate slow food. I cook at home every day, and I think there is nothing like eating healthy because of the way it makes you feel long term. Everybody's busy today, but people work to have quality in their lives, and healthy food is quality of life. I eat without restrictions, but without any kind of exaggeration. And I'm all about slow food with diversity in the kitchen. I recommend that. And I think food is something very important to prevent not only cancer, but all diseases. Kids who have restrictions for health conditions, religion, or any kind of restriction in their alimentation need attention to make sure they are well nourished. Exercise is important as well. Kids need to be active physically, and that helps them to develop mentally. To avoid kids' exposure to radiation and also during pregnancy is very important. Using strict drugs during pregnancy can be very harmful for kids in several ways, as well as alcohol and cigarettes. Getting vaccinated for HPV is very important for kids, both girls and boys, starting from 9 years old, because HPV is an oncogenic virus. It can cause genital diseases and even genital or cervical cancer. Not all these types of cancer are caused by HPV though. The vaccine is very important because the rate of HPV virus in teenagers is alarming. Most people who get the virus, their bodies will rid of it by itself, and only some people develop cancer. And although the use of condoms is highly effective to prevent contact with HIV and other viruses and bacteria, and it even reduces the chance of contact with HPV, it can't eliminate the risk of HPV because the lesion can be in another area that is not covered by the condom. So HPV vaccine is essential for kids to try to reduce the high rate of HPV in teenagers and adults. It's a matter of collective health.
Right. So you've shared how it can be prevented, but in case kids do get cancer, so in your book, Cancer Daily Life, there was this wonderful thing that you mentioned. Wonderful in the sense that, I mean, not exactly wonderful, but it was something very enlightening. That there's this line that says that cancer for kids is to feel like you don't have to change anything in your life when a pandemic starts, right? So obviously that means that, it's a kind of announcement that, children already have this kind of limitations, and pandemic has been very difficult for us. We weren't used to living this kind of restricted life. So what are some of the limitations that, particularly for young kids, that that having cancer places? So what are the limitations that the young kids need to deal with when they are um, when they are undergoing treatment for cancer?
I'd like to show some creations. Consider every precaution that people started during this pandemic. Kids with cancer and their families have to take the same precautions even without a pandemic, because chemotherapy reduces the number of leukocytes by a massive amount. So alcohol 70% is already a must-have in every house and car, and anywhere the families are going. Wearing masks is already very common for these kids. Every care we are all taking now was already the routine, and also of the healthcare professionals.
Uh, okay, in your other book that you written for children, one of the other ones, which is Bald is Beautiful, A Letter for a Fabulous Girl, in that, yes, so in this one, you talk about how being bald doesn't take away from the beauty of anybody, any kid. Okay, I want you to show one illustration, that sunflower one, the where she wears the headdress. I think I've mentioned, yes, I've mentioned that in my review as well. You could show that illustration from this book. It was very pretty.
This one.
Yes, this
No.
one. Yes, very pretty. Yeah. So this one, right? So this book shows how it's important that beauty be not defined by whether or not you have hair, but beauty is about strength. Beauty is about happiness. So, Carola, I'd like to tell you, since you've been working with young cancer patients, um, what is how do kids in general deal with this idea that they have to undergo chemotherapy and that they might lose their hair as a consequence, or people might make fun of them? So how do kids react to this, and how have your books, such as this one, Bald is Beautiful, created a positive impact in this regard?
It's so cool to work with kids. They feel everything in another way. Kids I treated, they would go to chemo telling me they were superheroes or eating fried food, and they have a resistance that adults don't have. They have a faster cellular renewal. Those doses of chemo for kids are higher than doses for adults because of that. And that's something people are impressed with when they find out. And psychologically, they seem to handle everything better. They are very curious and want to learn what cancer is, about the treatment, and skills to cope are very important. They need to hear that cancer is not their fault and learn a bit about the disease to understand that. But they cope with cancer in a great way. They want to talk about it, learn about it, and I think many times it's more difficult for the parents than for the kids. Kids with cancer need support, and the parents are often coping with this, that their kids has cancer, and they have so many questions. That's where the books enter. They have the right words to cheer them up, to show love. There are many different children's books about cancer, each one for its necessity. God is Beautiful, for example, is not a book to explain cancer. It's a book about self-esteem, self-acceptance, a loving message, and it shows people that cancer is normal. It's great to be gifted and to be read in classrooms to prepare the kids to welcome the new beauty of their friend.
Right. So when you create books of this kind, right, what are the specific challenges that you face in writing in such a way that you're also talking about the issues, but you maintain throughout a positive and happy tone? What are the challenges you face in creating this balance of telling the severity of the situation as well as um, just providing a lot of optimism to kids and even to parents who or others who read the book?
Everything is carefully thought out and studied. The most challenging thing is what I like the most in writing books about cancer for kids. It's to make a complex concept easy for kids to understand. For example, my book Chubby's Tale, the true story of a teddy bear who beat cancer. It talks about stem cell transplantation and even homing of stem cells. When someone donates stem cells, the cells are collected from their bone marrow, but the patient receives the cells through their veins, just like a blood transfusion. The stem cells know the way home. They make a very complex process called homing to the bone marrow of the kid who receives the stem cells. And that has everything to do with Chubby in a toy store, trying to find a home, wanting to go away with a kid. Then he finds out he has leukemia and is treated by Dr. Doll. There is a new edition of Chubby about to be released. I think this month I will release the new version of Chubby.
Thank you, Carola, for sharing this. Uh, okay, there are so many people who are fighting cancer, and you've met so many. So, and in your book, in Cancer Daily Life, I remember you'd written this one thing that there's a newfound bravery that a lot of people have after having um, undergone this ordeal. So, um, can you share some story about some cancer warrior that's inspiring? Any inspiring story you remember?
I worked with a lot of cancer warriors. Most of the team I worked with in pediatric oncology were women, and most of them had cancer in their childhood. I've worked with a lot of heroes that now, years later, are using their experiences to help kids. 80% of the kids I treated were cured. I think this represents several beautiful stories of warriors and those 20% as well, because they had to go through these and stay strong even though their chances were few or none. The information like what we are talking about here is very important, because this 80% can go to 90% with more information and the patients coming earlier to be treated. better access, more investment of the government in this area. The US has about 84% of kids cured. We Brazilians are not bad for a country less developed, which still needs to focus on malaria, tuberculosis, malnutrition. But we healthcare professionals work hard to use and adapt the best treatments that are done in countries like the US and Germany.
Okay, now, of course, there are, stories to learn from, inspiring stories, but at the same time, I believe, I mean, of course, it's, I think, pretty understandable that it's not very easy to, keep yourself positive, because chemotherapy is difficult for um, both the patient and the caregiver or caregivers. So, can you suggest some ways in which people can prepare themselves to deal with chemotherapy? And also, what are some of the ways in which people can deal with long term effects of cancer, such as the emotional um, long term effects?
Books help a lot, both to cope and support and to give to people who are going through this with them. It's exhausting to explain the same things again and again, so sometimes it's best to share a book with the people who are around. Embrace the pain. There is no easy way. So leave it, then let it go. The emotions are like waves. They change, they meet, they hit less hard with time. Take care with your alimentation. Understand that people only offer what they have to offer. So many people around don't know what to say and how to help. So it's interesting to be clear with them about how you feel and what you need. Psychologists can help a lot both immediately and in the long term.
I think this is a very important point that you've made, that people should be careful about what they say and how they behave. That's something really important. I think that would also go a long way in helping people cope, because I think for chemotherapy particularly, we know the one of the side effects is that you can get bald. So, and more than anything else, it's the fear of other people's judgment that is very scary, is a very, very scary prospect for patients. So great that you made that point. And anything else, anything useful, or anything that you would like to tell people to um, just keep in mind, or just anything, any experience that
I
you.
I would like to ask people to get in touch, to check my website, kidscancerbooks.com. And I think that's it. I'm very grateful for this opportunity. I love it, this interview. Love to be here with you. Your work with the education and knowledge and promoting books and reading is so important. And I'm very grateful for being invited. Feel very honored to be here today.
Thank you so much to you, Carola, for taking out the time to share your knowledge. And I'd like to tell everyone that we owe a special thank you to Carola, because English is not her first language. Her first language is Portuguese, but she has made the effort to learn the language, to write her books in English so that they reach a large number of people. And she's also made an effort to uh, tell us through this video in a language that we can understand. So thank you so much for making that extra effort for us, Carola. And it was great talking to you. Um, and I have reviewed, I think I mentioned that two of her books. Um, One is Bald is Beautiful, a letter for a fabulous girl. The other is Cancer Daily Life. The reviews for both are there on my book review blog, which is ronikawahi.blogspot.com. The exact links I will provide in the description box. I'm also adding links for Carola's books. You can check them out, and certainly do check out her children's books as well. And if you enjoyed watching this video, if you found it useful, please do like, share, and subscribe. Thank you.